So good evening. My name is Pablo de Jesus. I'm the Executive Director of Unitarian Universalists for Social Justice. We're going to get started. A little bit of housekeeping before we go. We are recording. So if you're uncomfortable with that, I encourage you to turn off your screen. And you should feel free to do that if you have to take care of household or bodily needs. In general, we're going to ask folks to stay on mute and self-regulate. We want to show respect for the guests and the content that they're sharing with us. And this is not a webinar account with Zoom. So you're on your own recognizance to manage your own mic. I don't want to have to do that for you because then you'll be trapped silent for as long as it takes me to remember you specifically. So please mind the mics. I want to encourage you to place questions in the chat, but I encourage you to be brave and ask questions directly when we get to the Q&A portion. I would encourage folks to use those reaction buttons that Zoom offers. More often than not, at the bottom of your dialog box, you'll have something that says reactions, and then you can raise your hand or show a little party hat or a thumbs up, all those different things, rather than making outbursts. And then I will introduce each of the speakers prior to their comments. So please listen attentively for that information. And I want to thank you all for joining us. We know that there are several events tonight pulling UU participation, but we thank you for your interest in the UUJEC AIW and UUSJ's effort to support that work. We are committed to a people-centered economy with common sense healthcare and labor solidarity. And we hope that this session will help us move us in that direction. So again, please put into the chat who you are, your name, your state, your congregation, your pronouns, a land acknowledgement. And I do want to clearly acknowledge that this event is in solidarity and support of the UUJEC AIW, and that they as an organization have a history for pushing UUs on our thinking around the economy. So I appreciate the work that they put into the AIW. I also want to thank all the speakers before we get started, and I'll do so again. And with that, I want to request that Terry Lohman give us a short comment on why the ProAct and why the AIW, which also cites Medicare for all, and to my view seems grounded in compassion for workers, care providers, and a need to move our economy towards justice. So, Terry.
Okay. I'm Terry Lohman, and I'm co-chair for UUs for a Just Economic Community, and largely driven by Reverend Bob Murphy. We got our AIW on the pandemic accepted, and the reason we included the ProAct as part of our goals is that when labor has power, uh, good things happen. And the erosion of unions and the erosion of labor's power has really had a very negative effect on our working fairness. The compensation of workers is flatlined while management has doubled every few years. So that's why we included it, and we want labor to have the strength and the power to provide good benefits and justice. Thank you.
Thank you, Carrie. So with that, our first speaker is going to be Gina Kelly, who is a government relations specialist with Network Lobby for Catholic Social Justice. And Gina oversees the labor portfolio, which includes priorities like paid leave, unionization, livable and fair wages, and non-discrimination legislation. Before joining Network, she interned at Northwest Workers Justice Project and in Senator Merkley's Portland office. And she's a volunteer teaching English to adult migrants in night classes. And she has previously worked as a research assistant at Pacific University, contributing to published academic work, as well as publishing her own undergraduate work and for peer-reviewed journal portfolios. So with that, I want to say clearly that Network Lobby for Catholic Social Justice is a great friend to UUSJ. And we see them as a leader in the field of interfaith, faith-based advocacy focused on federal engagement. And we are deeply pleased to have Gina with us here this evening. Thank you, Gina.
Well, thank you so much, Pablo. It's great to be with everyone today. That was a lovely introduction. So at Network, we often talk about rooting our faith and our spirituality in encounter. And so whenever I give these briefings and talk about things like legislation or labor reform writ large, I always like to kind of start off with why this matters to me and why I do this work, because I think that's really important in us drawing connections as to how these issues impact us and our communities. So I am a native Californian, specifically from Sonoma County, which is known for its wonderful wine. It's right next to Napa County. It's very lovely. And that means it's filled with and surrounded by vineyards. And in California, fourth grade's history year is state history. And that was the first time I was introduced to the United Farm Workers and to the incredible leadership of Cesar Chavez and Dolores Huerta. And I grew up and lived in communities of first generation Americans whose parents often were working, really long hours in fields or in low income jobs. And I saw that my classmates, my students, my friends, my neighbors were being impacted by a lack of labor reform and a lack of law that recognized the dignity of work and the dignity of worker. And so that was really impactful and transformative for me. And then, as noted, I have and continue to off and on teach English to migrant workers, and those relationships and friendships with those who give us the food on our table is always transformative in my life. And additionally, I worked with low-income workers who were working to present wage theft cases, who were not being given overtime or who were being denied wages for all sorts of really awful reasons. And so doing that work with clients who, just didn't have unions and didn't have all the resources they needed to be given a dignified way of life was really impactful for me. And so working in labor reform in DC is really the honor of a lifetime for me. And being in solidarity with workers is truly one of the greatest things I actively do every day. So I'm really excited to be with you all, given that long preamble. And so I also wanted to kind of open us up with a quote from Cesar Chavez, who reflected on his relationship with his faith. He said, "It is possible to become discouraged about the injustice we see everywhere, but God did not promise us that the world would be humane and just. He gives us this gift of life and allows us to choose the way we will use our limited time on earth, and it is an awesome opportunity." And so I think we can see, even just from that small quote, the ways that so many labor leaders have tied their activism and their work with their faith, and that is exactly what Network aims to do. And there's a really robust and amazing history of the faith community working in solidarity with the labor movement. Many labor leaders have actually rooted their work in their faith tradition. The first major union in the United States was the Knights of Labor, and at their height had over 800,000 members. And there are some reports that say a majority of those 800,000 members were actually Catholic, despite being open to all. In 1925, A. Philip Randolph, who's one of the heroes of the labor movement and was a devout son of the African Methodist Episcopal Church, organized the Brotherhood of Sleeping Car Porters, and became the labor leader that we know him to be today. And in 1934, the Jewish Labor Committee was founded and proposed its work to fight discrimination, prejudice, and intolerance in the workplace. And I'm proud to be able to work with the Jewish Labor Committee and other Jewish organizations now, continuing that work that was started all the way back in the 30s. And I think too often we forget that Reverend Martin Luther King Jr. was in fact a reverend, and he, worked on civil rights movement rooted in his faith, and that labor reform, unionization, repealing right to work laws, all of those things were core to his work and his belief of advancing racial equity in the United States. So with all of that being said, people of faith in labor unions then and now, today, right now, share a belief in the dignity of work, the right to a living wage, the need for safe work environments, and the promotion of healthy, well-balanced lives for workers. And we also know the power of unions. Unions are key in giving workers a voice and the ability to advocate their own needs to their employees. I like to talk about unions as megaphones. They amplify the voice of the workers to those who need to be told what they need and give them the ability to advocate for themselves for things like comprehensive health care, paid family medical leave, improved scheduling practices, safety protocols, and whatever else affects them in their workplace and their community. We also know that removing barriers to organizing and bargaining increases protections for women, people of color, immigrants, and the LGBTQ+ community. And we know that so many faiths, it's such an interfaith value to care for and love those most marginalized. To love the least of us is to love everyone. And so unions are a really key policy step in achieving that and seeing that belief. Personally, in my time working with Network Lobby, I have personally seen the power and influence faith-based organizations have in this work, especially with legislators. So I work with a wide range of coalitions, and in so many of them, faith constituent voices, so you, are the most sought after in meetings with representatives and with senators. Your voice really matters, and it sounds cliche, but it is impactful. I have seen senators change their votes. I have seen representatives decide to co-sponsor critical labor reform because a constituent came to a meeting and said, this matters to me and my community, and here's why it's important to us, and here's why it's rooted in my faith. My faith calls me to talk about the need for the worker and recognize the dignity of work, and that is really impactful and transformative to many of our representatives. And too often the faith community is kind of seen as a monolith. There's one perspective, and the faith community can be seen as separate from policy work. There's the faith community and there's the labor workers, and they're not separate. As I've laid out, there's a strong history of faith communities and union organizers not only being the same people, but being collaborators. And it's the same in issues like healthcare and on climate action. And the more we put that in front of representatives and in front of staffers and we make our voice heard, the more transformative that change can be. And these issues are so important. Labor is near and dear to my heart, and part of the reason why I love labor is because it affects everyone. I like to say that the labor movement is the movement of the people. It's the movement of the everyday family who's trying to make ends meet. It's the movement of your neighbors, your friends, your families. And I think as we've seen with this wave of strikes across the country and the continued fight for 15 and the mobilization around the ProAct, there's real energy for labor reform. And it's really powerful to see that folks use their faith, use their belief in justice and equity to advocate for this critical legislation. And so I'm really grateful that we are all working together to root our economy in solidarity and to create a world that's more just for workers everywhere. And so I just want to close my comments by saying thank you so much for being here and getting excited about the ProAct. And I'm so excited to hear what everybody else has to say.
Thank you so much, Gina. And I want to allow Paulette to remove the spotlight. Oh, there we go. And make sure that we find me. There we go. And I want to say clearly to the UUs who are on this call, because one of our speakers has a wonderful background that reminds me about Build Back Better. And on Monday, I want everybody to know that on Monday, the 13th, UUs will be out in force with Reverend Barber for the action in Washington, D.C., and that President Susan Frederick Gray, or Reverend Susan Frederick Gray, will be in attendance. She will be making formal rally comments as part of the rally. And prior to those formal comments, she will be doing an ingathering with UUs to hold us in fellowship and center us for that action. So please look to your UUSJ emails, as well as Side with Love emails for details. If you want to get the exact location of all that stuff, it's important that you RSVP. But bearing in mind that labor and faith organizers have always had a deep and meaningful relationship, I'm now excited to introduce Reverend Michael Spizak, who is the Religious Labor Coordinator for the AFL-CIO and in the Civil, Human, and Women's Rights Department. He became active in the labor movement as an undergraduate in Boston at Boston College before coming to the AFL-CIO in 1986. And he worked on the Farah boycott, the J.P. Stevens boycott, the Brookside mine strike, the Carolina Brown Lung Project, and was a researcher for the AFL-CIO Food and Allied Service Trades Department. He has also been a member of a number of local unions, including SEIU, AFT, and the Newspaper Guild. And while at AFL-CIO, he has been a strategic campaign coordinator and provided campaign support to AFL-CIO affiliates. He also spent part of his time as the AFL-CIO state legislative coordinator. He is a retired United Methodist minister, so more properly referred to as Reverend Michael, with the Baltimore Washington Conference, and has a Master of Divinity degree and a Doctor of Ministry degree from Wesley Theological Seminary in Washington, D.C. He is married and has 2 grown children, and it's been an absolute honor and pleasure getting to know Reverend Michael in the process of preparations for this evening, and I can see why his wise counsel has been so deeply valued in this region and with the AFL-CIO. So with that, Reverend Michael.
Yes, hi. I want to thank the Unitarian Universalists for social justice and the Unitarian Universalists for a just economic community for this opportunity to address the importance of the Protecting the Right to Organize Act, the ProAct, and thank all of you that are joining us for this webinar tonight. My name is Michael Spock, and I'm the AFL-CIO Religion Labor Coordinator and the lead on the ProAct Faith Community Outreach. And my colleague, Carlos Jimenez, will join me as a co-presenter. He'll have to introduce himself. He is the AFL-CIO lead on the ProAct Allies Coordination lead. Our goals are to provide you with an understanding of the ProAct, how the ProAct aligns with the principles and values of Unitarian Universalism, explain what is happening to the legislation in the Senate, and how you as a Unitarian Universalist can support passage of the ProAct. And but first, what is the AFL-CIO? The AFL-CIO is a democratically governed federation of 57 unions that represent 12.5 million working people. Each affiliated union has its own distinct membership and unique voice, similar to every Unitarian Universalist congregation. Our members have come together to build and support the rights of working people. And in pursuit of these goals, we also fight against social and economic injustice. And I just want to refer you to our website, www.aflcio.org. What is the ProAct? This short video explains the bill. My guy Carlos
We
is
will
my
give
tech.
Carlos a moment of grace.
There's my tech guy.
What is the ProAct? It's the most significant worker empowerment legislation since the Great Depression. The ProAct would create a fair process for forming unions so we all can have a say in our wages and working conditions. More than 60 million workers say they would vote to join a union today if given the chance. The ProAct would give them that chance. So, what's the plan? 1. The ProAct empowers workers to exercise our freedom to organize and bargain for improvements at work. It will ensure that workers can reach a first contract quickly after their union is recognized. 2. It will repeal Jim Crow-era right-to-work laws that lead to lower wages and unsafe workplaces. 3. It will protect collective action and prevent companies from permanently replacing workers on strike. No worker should be punished or lose their job for speaking up for their rights. 4. The ProAct will create pathways for workers to form unions in new industries like big tech without fear of retaliation. And 5. It will hold corporations accountable by strengthening the power of the National Labor Relations Board and creating real penalties for companies that violate workers' rights. But the ProAct is much more than labor law reform. It's also civil rights legislation. A union contract is the single best tool we have to close racial and gender wage gaps. Contracts ensure dignity and due process for all workers, regardless of where we were born or how we identify. The ProAct will fight inequality for every worker. We know that when union membership declines, inequality skyrockets. Even though productivity has increased by 74% from 1973 to 2013, hourly wages increased by only 9%. This is not fair. Working people shouldn't be fighting for scraps while companies profit off our labor. We won a mandate when we elected pro-labor leaders to the White House, House of Representatives, and the Senate. This is our once-in-a-generation chance to win the change we need. Working people deserve a voice on the job, at the bargaining table, and on the picket line. It's time to reclaim our power. Call your senators and tell them to pass the ProAct.
Well, let's look at the ProAct through a Unitarian Universalist lens. The action of immediate witnesses' support for the ProAct is certainly a reason for Unitarian Universalists and the Afl-Cio to be working together. But more importantly, the Afl-Cio and Unitarian Universalists share many values in common. These shared values are expressed in and through the various principles of Unitarian Universalism. I would begin with the first principle, the inherent worth and dignity of every person. From this principle flows the historic and ongoing commitment of Unitarian Universalism to the right of working people to organize unions for collective bargaining. The ProAct would strengthen current labor laws which no longer effectively protect the dignity of workers seeking to organize. The second principle, justice, equity, and compassion in human relations, points to the fair treatment and just and equitable working conditions that collective bargaining and a union contract can achieve. The ProAct is civil rights legislation. A union contract is one of the best tools we have to close the racial and gender wage divide. A union contract also ensures dignity and due process for workers, regardless of where they were born and where they are or what industry they work in, especially for people of color, the LGBTQ community, and immigrant communities. The fifth principle, the right of conscience and the use of the democratic process within congregations and in society at large, supports workplace democracy and the freedom to organize a union free from reprisals. The ProAct would more effectively prohibit employers from engaging in unethical and immoral actions to discourage and prevent workers from forming unions through the democratic process of a union election administered by the National Labor Relations Board. Through a Unitarian Universalist lens, the ProAct addresses the moral issues of the freedom to organize a union without fear of retaliation, the rise of income inequality due to the decline in unions, and unequal treatment in the workplace, especially for the most vulnerable during this pandemic, such as people of color, the LGBT community, and immigrant communities. Now, Carlos will address the ProAct state of play and the current political and issue context for the ProAct.
Thank you, Michael. And hey, everyone, it's a pleasure to join you, and thank you for the opportunity to be here tonight. Just really quickly, my name is Carlos Jimenez. I have the pleasure of serving in a special projects capacity at the Afl-Cio. And I, in addition to thinking about the ProAct and supporting, the work of the Federation in passing this piece of legislation in the campaign, I think broadly speaking, I spend my time here and my efforts really thinking through with affiliates, with our network of state and local federations, and really the Federation itself. I think thinking about the strategies and the types of conditions and work we're going to need out there to really grow the labor movement. Thinking about partnerships and collaboration and how to do coalition building of sorts. So before coming to the Federation, I had the pleasure of serving as executive director at the regional labor body here, the Metropolitan Washington Council, and spent years before that kind of working in the Midwest and in other labor campaigns. So kind of a history in the labor movement, but also just one in coalition building and working in partnership, which is just to say it really is very great to be with you all. So but anyway, state of play and beyond introduction, and I'll be quick here. Zooming out or stepping back, one of the things at the Afl-Cio we're trying to do through our campaign and this campaign and mobilizations to pass this piece of legislation, and hopefully as you started to see through the video, is we're really trying to refocus and sharpen the national conversation, or the broader discourse, if you will, on what's happening with workers in the workplace and in our society, right? Michael was talking a little bit about the pandemic, but also particularly how bad it is when they try to organize a union. And just some brief examples, right? What happened with the workers in Bessemer, Alabama and Amazon when they tried to form a union, which made national news, this last year. An election so egregious with labor violations that the National Labor Board just ruled in the last few days that it needed to be reran because Amazon had grossly interfered with workers having a chance to have a free and fair election. Well, that's happening everywhere, right? How those with power and corporations are using replacement workers to punish and disregard the opinion of workers who go on strike, as could happen with Kellogg's, right? At a time when it's extremely profitable. That really needs to get understood a little bit more, right? Or how groups of lawyers and senior corporate management will sit down with individual workers, who are thinking about forming a union and conduct these really intimidating sessions to, talk to them about their union views, something that just happened with Starbucks workers in Buffalo. That needs to be seen more, right? And so, because we really want people to understand just how broken our labor laws and systems currently are. And that we really work and then push and educate them on the ProAct and what it would do, right? Because it's pretty big. And more importantly, I think that we're going on to build the political support and the coalition that can help pass this piece of legislation, but more importantly, go on to build a more powerful labor movement, right? Which, full disclosure, will take more than just labor law reform, right? And so it's going to take all of us in continued work and really supporting workers, helping get a better deal in this economy. And so in terms of state of play and where we are, just quickly, before passing it to Michael, I think our general thinking is that, look, we're committed to passing the ProAct, and I'll say this intentionally, and other bills and policies that meet our goals, which include Build Back Better. And I say that because I'll come back to that really briefly in a second. But in terms of the ProAct, we're at 48, 49 co-sponsors, depending on how we're cutting it. And we think and know pretty confidently that we're at 50 votes in terms of bringing, supporters that will bring it to the floor. But the truth is that we want to continue to work to solidify and improve that, and are actually spending a lot of time in Alaska, Arizona, Virginia, and some other states to find that support. And that work is critical. And we actually thank you and many of our allies who are on this call who have been helping work towards that. And generally, so we're committed on calling and moving the ProAct question and seeing where, our members of Congress and in the Senate, where it now is on both the Dem and the GOP side for that matter, are on the bill. And I think, the thing to take out of that is that, continue to then move out and expand from our focus states to a more national and broader 50-state campaign, right? But before we can do that in terms of the broader campaign for the ProAct, and this is actually not a bad thing. On the contrary, I think it's a good thing. I think it's pretty important for us to just acknowledge and recognize what's, in the moment and in the discussion right now, which is Build Back Better and the reconciliation, package at hand, right? And so BBB, as it's often called, is many things, and it is big, and it also includes a few key and meaningful provisions that are in the ProAct. But it's not just like that one provision or the penalties that would come to employers who break the law when workers try to organize, which matters. It's actually about making those with wealth and the corporations that are doing the best pay more of their fair share, right? It's about combating climate change through the creation of good union jobs, right? Or jobs that have more standards, more opportunity. It's about lowering costs on American families and workers, right? It's making pre-K or getting pre-K closer to universal. It's on investing in college affordability and so many more things, right? And so this specific month, since we're talking about the state of play, we're focusing our mobilization and engagement on the need to pass BBB, continue to invest in American families, and really lifting up for members of Congress how it's actually a down payment of sorts and a continued investment, on changing and improving the rules for workers, right? And so it starts moving us and getting momentum for the ProAct, given the elements, So anyway, so that's where we are at the Afl-Cio this month. And so I just wanted to give that state of play and context. And with that, pass it back to you, Michael, to round us out.
Thank you, Carlos. And what I'd like to do is, this is a call to action. We appreciate the assistance that faith leaders have given to our mobilization efforts. And we're in a moment of worker action for economic justice, as Carlos has pointed out: Striketober, Strike Giving, the Great Resignation, and union organizing campaigns around the country. There is a strike map on the Afl-Cio website, and your support for striking workers would be welcome. We need you to stand with workers as we mobilize in December, and with our continued push to pass the ProAct in 2022, with activity in Alaska, Arizona, and Virginia, and other states. Unitarian Universalists can do the following. First, organize delegation visits to targeted senators in Alaska, Arizona, and Virginia, and arrange meetings with senators in all of the states where Unitarian Universalists have membership, especially GOP Senate offices. Second is to generate individual letters and phone calls to Republican senators in all of the states where Unitarian Universalists have membership. Three is invite a speaker from the Afl-Cio in your area to address your group or congregation about the ProAct. And four, support workers who are organizing a union or fighting for improvements at work. Carlos is going to drop links into the chat, links for the ProAct website and action page. I want to thank you for your commitment to justice and working people, please go to the ProAct website and action page to get involved. Also, you can work with Pablo and Terry to connect with us in any of these or other ways. And we look forward to partnering with you in this vital effort to pass the ProAct to address income inequality, protect our democracy, and improve the lives of tens of millions of workers for generations to come. Thank you.
Thank you so much, Reverend Michael and Carlos. And I can't say enough that it's been a pleasure to get to know Carlos as well. I didn't say that clearly enough. I was expecting to introduce my dude, my new guy on the ProAct and on labor issues. And, you know, I just want to share with folks that when Terry and UUJEC came to me and said, you know, gee whiz, what can we do? Can we at least do an action alert, which you can find in the chat right now? You know, I was reminded that back in 2017, UUSJ and UUJEC collaborated on a conference regarding healthcare, and that one of the speakers was Representative Ami Bera, and he spoke about mostly healthcare, but he did throw in a comment about how it's always been labor that has driven forward progress on healthcare because it's part of the package of needs for households. And if you're thinking about the role of the worker in the household, then you invariably come to the fact that healthcare is a big, you know, one of the single biggest drivers of cost in household economies and household budgets. And on top of that, healthcare is among the single largest cause of personal and individual bankruptcy. So there's a relationship here between labor power, household strength and sustainability, and what we're doing and thinking about healthcare. And the UUJEC AIW included not only a mention to the ProAct, but also a mention for Medicare for All and the system of care that we have going that's wrapped around our labor markets, our markets where folks are acting as actors in this economy. So my, frankly, first thought was to get one of our collaborators from that conference, Melinda St Louis, who is also a member of All Souls Church in Washington, DC, and ask her if she could join us to contextualize how we would be talking about labor in the healthcare portion or dimension of this conversation, precisely because I was right. So many of you emailed me individual questions and asked about that aspect leading into tonight. So with that, I'm very pleased to introduce Melinda St. Louis, who is the Director of Public Citizens Medicare for All campaign. And for the past 20 years, Melinda has led multiple campaigns that challenge corporate power and promote economic justice and human rights, including fighting big pharma, greed in global trade agreements, and other bad actions. She is now thrilled to focus her energy on building a movement to finally deliver guaranteed health care for everyone in the United States. She received her master's degree in public policy from Georgetown University. And yes, I did say that she is a member of All Souls Church. So she is among friends and family, even if she didn't know she had them. And with that, Melinda.
Thank you so much, Pablo. And yes, it's a real pleasure to be among UUs. I've been a member of All Souls Unitarian Church here since 2003, and I sing in the choir, and it's like one of the most important parts of my life. So it's great to be here with all of you. Let me just share my screen if I get this to do this correctly. And I want to go to slideshow and from the beginning. Okay, great. So it's and I want to thank Pablo. I want to thank the UUJC and UUJEC and UUSJ, and then just also very grateful for the opportunity to be here with colleagues from the Afl-Cio and also from Network, who we've done a lot of great collaboration in the past. So it's great to be here with you. So just to kind of, I think I'm really moved by all of the work that's being done around the ProAct, and it's absolutely critical. And so really thrilled that the UUA is engaging on this. To give it just an overview, kind of, around healthcare, I think it's no secret to anyone that the U.S. healthcare system is broken, though sometimes people will say it's actually not broken. It works as intended to create profit for large corporations. But the reality is that 30,000 Americans at least, sometimes some estimates are more like 45,000 Americans die each year from lack of healthcare coverage. 100 preventable deaths per each day, and that was before COVID-19. Nearly half of adults in the United States reported not going to the doctor when they were ill due to cost. 1 in 3 adults reported that they skipped medical treatment that they needed because they couldn't afford it. 1 in 5 say they skipped prescriptions or cut pills in half because of the cost of their prescription drugs. And the outcomes are quite dismal for the richest country in the world. Our infant mortality rate is 25% higher than our neighbors in Canada. It's practically triple the rate in Japan. We rank 43rd among the world's nations for life expectancy. That's behind Cuba, that's behind Chile, and a number of other countries. And we're talking about workers, and I think we have a healthcare system that is based partially around our employment. And what that has meant is that for workers, workers are often forced to stay in suboptimal jobs because of health insurance. If you have a spouse who has an illness, you are likely to stay in the job that you have if you're lucky enough to have insurance, even if it's not working for you. For unions, more and more unions are finding that at the bargaining table, health insurance is the top thing they're bargaining over, more than wages, and often are now having to trade away any potential wage increases in order to maintain or actually have their health insurance just get a little bit worse next year instead of a lot worse next year. Because of the extraordinarily increasing costs of health insurance for employers. So employers, it hasn't been working for employers either, but obviously they pass that on to workers. And that's a large reason why we have seen wage stagnation in the United States, that you can actually look and see as health insurance premiums have gone up, wages have not. Striking workers, we talked about striking workers. They're at risk of losing their health insurance if they go on strike. And that is a key issue that many workers have to take into account if they go on strike. And you actually hear stories of people who get a cancer diagnosis when they're on strike, and then they are worried that they won't be able to get care. And then, of course, during the pandemic, we had at least 12 million people lost their insurance along with their jobs. We saw many more people actually lose their health insurance, but this many weren't able to actually even get coverage on Medicaid, et cetera. So we've seen massive displacement during the pandemic. Again, losing your health insurance, losing your job during the worst healthcare crisis in a century is obviously suboptimal. And yet we as the United States spend much, much more than our peer countries, double what many peer countries spend per person on healthcare. We actually even spend more in public money, in our tax dollars per person than many other countries spend. So that includes Medicare, Medicaid, what we spend for government employees in the private marketplace, and the VA, et cetera. If we were more efficient, we would actually, what we're currently paying in taxes could cover everyone in the United States. And yet we allow for now we're looking at 35 million people without health insurance. So why are our health outcomes so poor? It's because the United States does not provide universal health care to our population. We're the only rich country in the world that has that sad distinction. The Affordable Care Act was an important step forward, but nearly 30 million people were still uninsured, and that was before the pandemic. And but importantly, even those with insurance are often underinsured. That means that their copays and deductibles are so high that they can't afford care, even with the insurance that they have. And we saw COVID further increasing those ranks. And as Pablo said, 2/3 of families that declare bankruptcy in the United States have crushing medical bills as one of the reasons why they are going bankrupt. And that's not just the uninsured. Even people with insurance find that when they get very sick, there are many things that are not covered. And we actually, so this chart says the insurance status of those who had medical bills. The employer coverage, 39% of people weren't able to pay for their medical bills, even though they had employer coverage. And the average cost of COVID-19 treatment with employer insurance ranged up to $20,000, and workers with insurance generally had to pay a deductible ranging from $1,000 to $6,000 if they had to undergo COVID treatment. And so why is it so expensive without providing adequate care in our system? And really, if you look at it, it's just absolutely clear. We have a fragmented multi-payer system that generates enormous administrative waste that has nothing to do with providing care. We have 1/3 of our healthcare dollars is going to bureaucracy and profit, not to care. So, and it makes perfect sense, because the primary goal of private insurance is not to provide care, it's to generate profit for shareholders. That it actually would be bad business for them to bring in more or bring in less than they're paying out in claims. So there's all the incentive in the world to deny claims if you're a private insurance company. And we're the only rich country in the world that does not use the negotiating power of their government to bring down pharmaceutical prices, and medical devices. So we, as our government, the Medicare spends far, far more than any other country on prescription drugs. The estimates are that we're looking at $600 billion per year in administrative waste. 600 billion, in administrative waste. We are, and so we know we can do better. This isn't even something like, how would we possibly do it? Medicare already controls costs very well. Medicare spends 2% of overhead on administration. Private insurance spends between 12 and 18% on overhead. Medicare has been able to control costs much better than private insurance, and it has provided nearly universal health care for seniors over 65 since it was passed in the 1960s. It is not a perfect program. So when I talk about Medicare for all, it's important to say that we're talking about improved Medicare for all, and I'll explain what that is. So the COVID-19, I'll just say, made the case even more for this, and I think that comes out in the UUA position. The private insurers profited more than ever during the pandemic. They limited access to care, and they booked billions, their most profitable quarters ever during the pandemic. You can think that there must be something wrong with the incentive structure there if that's true. As I mentioned, millions lost their insurance when they lost their jobs. Hospitals were focused more on profit and revenue. Many nursing homes also are owned by private equity because of the way our system failed to meet patients' needs, and we saw COVID run rampant. Our public health preparedness system lacked adequate funding, and the massive health disparities that exist, particularly among communities of color, meant that the morbidity rates and the mortality rates of COVID were extraordinarily disproportionate in those communities. And so I did pull from the 2021 action of immediate witness from the COVID pandemic position, and there was, General Assembly affirming its commitment to a healthcare system that's accessible, comprehensive, equitable, and culturally acceptable, and pointed to the Medicare for All Act of 2021. So we have been advocating on this bill, and I know the main focus for this action is the ProAct. Very much support that, but wanted to give just a little bit of background about what the Medicare for All Act is. It would improve and expand Medicare to cover everyone in the United States for their entire lives. And it would provide comprehensive benefits. So that is all medical care, all prescription drugs, dental, vision, hearing, reproductive services, long-term care, and would have the complete freedom to choose doctors and hospitals, eliminate all premiums, copays, and deductibles, so free at the point of service. It would simplify our healthcare system by moving to this single payer system that's similar to Canada's. It would prevent providers from using payments from the program for profit and marketing. So we would suck out all of the waste and profit out of the current system. Would provide global budgets to hospitals so that they would actually get paid for the needs of their community, not just how much their community is able to pay for various services, which would be extremely important for rural hospitals and hospitals that serve underserved communities currently. And it would allow Medicare to negotiate drug prices and so that we could actually bring down the exorbitant prices of prescription drugs. So just, this would be vastly increased choice. And I think that's really important to say. There's no more in-network, no more out-of-network. You know, people love their doctors. They don't love their insurance companies. So let's get away from this idea that people want to choose their insurance companies. They want to choose their doctors, and that's what Medicare for All would do. No one would have to worry about losing access to their doctor that they trust if they change jobs, or if their employer changes their insurance and suddenly you have to scramble and find a new doctor. That would no longer, if you had to move, your insurance would go with you. You wouldn't have to figure out how to get covered. And it would increase access to in-home or community-based services for long-term care. It would save trillions of dollars. And this is what I just want to make sure everyone knows, that we can't afford the status quo. There is we absolutely can afford Medicare for all. All the economic models show that it would save trillions of dollars in overall. And for families, it would save money. Currently, an insurance premiums for an average family is $21,000 a year. That is a highly regressive tax that people are paying through their when their employers are paying for health insurance. So if you increase income taxes slightly, payroll taxes, in order to cover Medicare for all, it would be far less than what families are currently spending on healthcare, except for obviously the wealthiest among us. So 200 economists support Medicare for all because, again, this is not about finding new money. It's about using the money that we're saving, or that we're using, in a much more efficient way. And it would help to reduce racial inequity in our healthcare system. Minorities are by far disproportionately represented by in the uninsured. So having insurance for everyone would be extremely important for everyone. But importantly, it directs research and resources to medically underserved communities and has an Office of Health Equity that would track and make data available on racial health disparities so that we can implement policies to address racism in healthcare. And so I just wanted to mention, these are just some of the unions that are endorsing Medicare for all. So we're building more and more support through labor unions who are finding it more and more difficult to hold on to the health insurance that they have tried to bargain for a long time. Political momentum's growing. We have more than half of the Democratic caucus in the House signed on as co-sponsors. More co-sponsors than for the first time have shown increased momentum. We know the polling is with us when people understand what Medicare for all is, and we've seen that even more since the pandemic. So there are some many ways that folks can get involved in this campaign, including helping to get more co-sponsors on the bill. We also have a municipal resolutions campaign where people around the country are getting their local city councils and county boards to pass resolutions in support of Medicare for all. We just passed 4 in cities across the country just this week. We have a toolkit. We have a webinar actually tomorrow that I'll drop in the chat if folks are interested, with Representative Katie Porter to talk more about this and some of our local leaders around the country. And my last thing is that I will also plug Build Back Better right now. We have some important interim measures that are in there, like negotiating drug prices for Medicare to lower prescription drug prices, to add a hearing aid benefit to Medicare, which is really important, and some other things that we are actively also pushing for within Build Back Better. So thank you so much.
Well, thank you so much, Melinda. And as usual, delivery of amazing content. And thank you for setting that broader context. Now, we're running short on our Q&A times, but I want to give everyone a moment to think about what they might have as a question. And the first question I'm going to direct at Carlos, and since he spoke about the state of play. So one of the questions from the chat was, can someone speak to the chances to pass the ProAct in 2022? Specifically, are there any Republican co-sponsors? Can we say it's bipartisan? How does it get through the Senate? Where for many things, we need 60 votes. Can it be added to a reconciliation bill? What is being done already to prepare the ground? So I feel
this was
you
the
that
perfect question. Oh no, whoever wrote this, I want to like be friends with, because it's like, it's almost like the way I would answer any of these questions is by needing all of the other questions. So kudos to whoever asked it, and I'll be brief and succinct in the interest of time. I mean, you know, if you'd asked me a few years ago, and this bill has been around for a little bit, I would actually have been bullish, or I wouldn't have been as sure a few years ago as I would be now. I actually think if you're looking at 2022, I think there's real opportunity and certainly space to move this campaign and legislation forward in some meaningful and significant way. But I think, as the question, you know, alludes to, there's other challenges, right? And so there's a few bridges to walk in, you know, trying to figure out any meaningful or transformative piece of legislation through the Senate, right? But let me take some of these in stages, right? So we are actually engaging and talking to some GOP offices, and particularly as, like, you know, issues of workers and the working class become more dominant in the discussion in politics. And so I think that's actually creating great space to talk and continue to talk about this. You know, and there are some independent folks that are supporting this that, you know, kind of can go both ways, including Angus King. And what I will say, you know, what makes me a little more hopeful about the chances is just the increased organizing and mobilization and action that workers are taking, like, and how powerful worker organizing has been in moving folks in the Senate. Like in Maine, those nurses, thousands of them organizing across the state, and the employer opposition, that was just brutal. And like, out of, you know, people couldn't believe what was going on, right? What happens to striking workers? Like, in this moment, as we're going through a pandemic, and all of us have been talking about honoring our heroes for the last year, to see how these workers are getting treated by corporate America. And like, as you know, some of these corporations are making insane profits, it's just making it more likely and possible that this goes forward, right? So I think, look, I think we're going to push and insist and persist, you know, at 50 to bring this to a floor. And I think, you know, the question alludes to, or is asking, about the filibuster and the chances that we may run into it, right? Which I think is a likely thing to happen. And I think, you know, in some ways, you know, we are open and aware that we would run into it. And I think are open and interested in actually figuring out how to have the conversation around, like, the filibuster and just, you know, the purpose of the Senate and government and democracy and like, and all of these things, which are important. I will say, though, I think a lot of that will depend on how BBB and reconciliation goes. There's a lot of, you know, a lot of things that will just be implicated by that, given its enormity and size and timing. But I do think that there's some real opportunity, and certainly from our end, we're gearing up and mobilizing in such a way to push and try to bring, you know, Build Back Better home through the Senate process, and then really shift to the broader push for workers' rights reform. And I like the last question, actually, because that last question, I think, is the magic piece. And I alluded to this earlier, right? That it won't just end with the ProAct or one piece of labor law reform. That what really needs to happen is we need to help the millions of people who want to join a union but can't because of the broken labor law system, a way to do that and get into unions. And so it means organizing, right? And I think supporting like real organizing drives and opportunity that may be coming, right, in 2022, right? What we're seeing organically or through strategic campaigns, right? We're just gonna see more and more of this. And I think, you know, the more we can support and be preparing for that and building these types of coalitions and kind of, you know, having these discussions, I think that all helps us, you know, with the ProAct. So I'll stop there, but I will say I actually think we're gonna push, insist, persist, and you know, at least on our, not try not to get dismissed on this question of labor law reform, and our leadership is really committed to pushing this and not backing away from it. So I'll stop there.
Thank you so much. I do want to ask two, sort of combine two questions in the chat, and I don't exactly know who to direct it at, so I will leave it to the speakers. The first part is, does the ProAct tie health insurance to employment? And then I guess related to that is how does or follow-up is how does the ProAct repeal right to work laws? Would it make state right to work laws illegal? So, can one of you, does one of you know if the
I'll
ProAct?
take a stab at some of these, though. I'll send some follow-ups just to confirm. I mean, I think, like unions aren't necessarily the arbiter, or like, like employers and employment is kind of like how health insurance is determined. And I think unions try to be a vehicle to ensure that workers have good insurance or quality insurance, and that employers are honoring their commitment in the social contract, right? And so, so I think this is a little bit of like a complex question. I think there is a piece and a provision in the ProAct that would create a test through which employers and employees can all be clear on what constitutes an employee versus, taking away one of the tools. And I don't know if this was in the video, but we'll send more materials. What can sometimes happen is that the rules of independent contracting can be used by some corporations who are interested in figuring out how to remove or place a barrier between themselves and their employees, and kind of remove them some of the responsibilities that come with traditional employment, Social Security, health insurance, retirement, et cetera, and kind of put some of those costs onto the public, right, et cetera, et cetera. And so I think there's, there's a provision in the ProAct that would clarify that there's a ABC test to figure out who's an independent contractor and who's not, for the purposes of collective bargaining and organizing a union, right? Not for, anything at all with independent contracting or not. So my sense is, I don't know that there's a giant link, but certainly, independent contracting is pervasive. There's millions of people doing it and under different arrangements. And I think we're trying to figure out like how to tackle the misuse of it. But, I think it's a good question. And since I'm not a technical policy expert, I'm not gonna, project to know the full answer to that. But I think, we largely don't touch it, is I think my answer.
Gotcha. Well, unless I see someone raise their hand with a burning question, I want to honor our speaker's time. We're already 2 minutes over, and I apologize for that, folks. And well, it looks like people are digesting, internalizing all the wonderful content we threw at you, that the team threw at you. I'm going to stick around for what I call lingering goodbyes to answer questions about UUSJ or anything else that came up that's on your mind. Think of it as a mini coffee hour after our session here today, but I want to formally thank the guests and release them to return to their private lives. We enjoyed your company with us this evening. We thank you for the wisdom and the insight that you shared with us, and we will do our best to contribute to passing the ProAct.